holidays can bring up a lot of emotions, and this cold, gloomy weather can also contribute to seasonal depression. And I'm joined now by Dr. Munther Berkert from Aurora Healthcare to talk about some of the signs of holiday blues. Thank you so much for stopping by today. So for starters, some people might say, okay, holiday blues, what? I mean, you're getting together with family. This should be a happy time, but for some people, it can be a little difficult.
Yeah, it really can be. We put pressure on ourselves, and holiday blues is typically situational, and it often passes by, but we put expectations on ourselves and pressure to perform or to be socially active at a certain level, and that can be hard for some people.
What are some of the signs that people should look out for if they are experiencing holiday blues?
Well, typically holiday blues are accompanied by anxiety. So there might be some resistance to interact with others, some isolation, sleeping a little bit too much, or not engaged as much as other family members are.
And who would you say is at risk?
Historically, people who put pressure on themselves, who have a history of anxiety. Oftentimes we get it confused with seasonal affective disorder, which is more of a clinical diagnosis associated with the time of the year, getting a little bit less sun, and it gets a little bit more cold out there. There's like a biological component to it that people really might need some treatment for.
Okay, so what are the differences that people should notice if they're wondering, do I have holiday blues or do I have sad? Is it something more serious?
Well, seasonal affective disorder typically lasts several months.
Okay.
It lasts 4 to 7 months, depending on the time of the year and how much cloudiness we're getting or lack of sun. Whereas something that we look at as holiday blues is situational, and it often passes by as we get through the holidays.
And if you are experiencing this, what should you do?
Well, first of all, we can be proactive in taking that care of our mental health as we would for our physical well-being. Pay attention to our symptoms, do things to be more active, engage in some mindful activities and things like that. But if symptoms get a little bit too much, check in with your doctor. There's a lot of integrative ways we're integrating behavioral health within our medical field. So a lot of the doctors are trained to look for symptoms and bring up these symptoms to your docs, and they'll make appropriate recommendations for you.
And if maybe you're not the one who's experiencing something like this, but you notice a family member is going through it, how do you suggest we approach them?
Well, you can ask them questions. Try to engage a little bit more with them and see if they respond to it, and encourage them to ask their doctor for help if they are engaging, if they are presenting with symptoms such as oversleeping, not eating as well as they should, isolated behaviors, or really negative thinking. Check in with them often.
And would you say this is something that's very common? I mean, how common is this?
Well, we all experience a little bit of emotional disturbance during times where we're getting a lot of cloudy months. It's a little bit harder to get out of bed. For some, it's a little bit more difficult, and the symptoms can be a little bit more severe.
All right, Dr. Munther, thank you so much for taking your time to talk to us about
Appreciate
this.
it.
We'll have a final check on what.
I feel like the other one distinguishes the rooms.
Yeah.
Right. This looked more gray online. Like it looked beige, and then that wood looks